Imagine a deep, burning pressure rising in your upper abdomen. A pain so intense it seems to wrap around your body, traveling into your back, stealing your appetite, your sleep, even your breath. Maybe it hits you suddenly in the middle of a meal, or maybe it creeps in slowly over months, disguised as mild discomfort, bloating, or unexplained weight loss, until one day it refuses to be ignored. Many people brush it off as acidity, stress, or just something I ate. But what if that pain is your pancreas calling for help? Today, in part 1, we're going to uncover the silent story behind pancreatitis, why this small, hidden organ becomes inflamed, the subtle and severe symptoms it creates, and the choices that can protect your pancreas before long-term damage sets in. A condition that starts quietly can become life-threatening if ignored. But with the right understanding, early signs become easier to recognize, and treatment becomes far more effective. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Let's start with the basics, because understanding pancreatitis begins with understanding the pancreas itself. Picture a soft, flat gland quietly sitting behind your stomach. Most days, you barely notice it, but it works constantly, releasing enzymes that help your body break down food and producing insulin that guides sugar from your bloodstream into your cells. When this delicate organ becomes irritated or injured, the body launches an inflammatory response. And that inflammation, if sudden or long-lasting, is what we call pancreatitis. Now let's see how it shows up. Acute pancreatitis strikes quickly. One moment you feel fine. The next, there's a sharp, gripping pain in the upper abdomen, often worsening after a meal or spreading like a band into the back or shoulders. Some people notice tenderness when the belly is touched, a fever, a racing heartbeat, or severe nausea and vomiting. Breathing may feel harder, as if the body can't quite keep up. Chronic pancreatitis is a different story, a slow burn. The pain may linger for months or years. Eating often makes it worse. You may lose weight without trying, or notice diarrhea and oily, foul-smelling stools. When the pancreas loses its ability to produce insulin properly, symptoms of diabetes appear: constant thirst, hunger, and frequent urination. Some people don't realize they have chronic pancreatitis until complications appear, and by then, the damage has quietly progressed. So when should you see a doctor? If you ever experience sudden, intense belly pain, or pain that simply won't go away, don't wait. Medical attention is crucial, especially if the pain is so severe that you can't find a comfortable position. The earlier the inflammation is treated, the better the chances of preventing long-term damage. Now let's talk about why pancreatitis happens. Your pancreas usually keeps its digestive enzymes switched off until they reach the small intestine. But if something triggers these enzymes too early, they start digesting the pancreas itself, causing irritation, swelling, and cell damage. Gallstones blocking the bile duct are one of the most common triggers. Heavy alcohol use, smoking, high triglycerides, high calcium levels, certain medicines, and even pancreatic cancer can also ignite the inflammation. Chronic pancreatitis often develops after repeated attacks of acute inflammation or from inherited conditions, autoimmune disease, or long-term alcohol use. And sometimes, despite every test, the cause remains unknown. Doctors call this idiopathic pancreatitis. Now here's why it matters. Untreated pancreatitis can lead to serious complications. Kidney failure may develop when inflammation overwhelms the body. The lungs can struggle, causing dangerously low oxygen levels. Infections can spread inside the pancreas, sometimes requiring surgery. fluid-filled sacs called pseudocysts may form, and if they burst, the bleeding and infection can be life-threatening. Long-term inflammation also interferes with digestion, leading to malnutrition, brittle bones, and weight loss. If insulin-producing cells are damaged, diabetes can appear. And over many years, chronic inflammation increases the risk of pancreatic cancer. So what can you do to protect your pancreas? The biggest steps start with lifestyle. If you have gallstones or a history of them, your doctor may talk to you about gallbladder removal to prevent future attacks. Avoiding alcohol and cigarettes dramatically reduces your risk. Both substances irritate pancreatic tissue and can trigger repeated inflammation. Some medicines can contribute to pancreatitis, so always review your prescriptions with your healthcare professional. Eating a balanced, low-fat diet, rich in fruits, vegetables, whole grains, and lean proteins, helps the pancreas work smoothly. And staying well hydrated supports digestion and keeps the bile ducts flowing freely. The key takeaway is this: pancreatitis is serious, but it's not hopeless. With early care, mindful choices, and regular follow-ups, most people can protect their pancreas and prevent complications. Your body is always communicating, and the sooner you listen to its signals, the sooner healing begins. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes, and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. In Part 2, we are going to discuss the diagnosis and treatment of acute pancreatitis. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.